Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So I have a couple special guests with me today in the studio, and I'm going to let them introduce you. We have Christina as well from ZO, and we're going to talk about skincare and skincare products and the ZO products, which are amazing. So go ahead and introduce yourselves.
Hello, I'm Marissa Staten with, obviously, Revitalize MD. I'm the medical esthetician and laser technician. And
hello, I'm Christina McCann with ZOSkin Health.
So we're going to talk about all things ZO today and just how important skincare is, period. I know that people don't always think of that, and then they'll come in and they'll be on skincare they think is good. And we like medical grade skincare, and that's all we have at the office. And ZO is an amazing line. It's my favorite line. And it goes back to, I think, hearing Dr. Obagi the first time,
2014?
Yeah.
September.
Yeah, so long time ago. And Marissa and I were together for that talk. It was amazing. And again, he used to have a Obagi line, and now this is his new line, privately owned, with all the control over the products, which is awesome. Makes a big difference. And he's just amazing. Like, again, he knows everything about skin. And so let's talk a little bit. Let's even probably a good starting point is his main kind of approach.
Philosophy.
Yeah.
And
Mm-hmm.
Yeah, and the first thing I want to talk about, Dr. Durst, you just totally hit it on the head, about how great this line is. And I'm going to go ahead and use my own testimonial to start off with. When I started with ZOSkin Health, I actually had started using some of the products before I started. Was I using them correctly? No. So I wasn't getting the true benefits. When I started with the company, obviously, I started using more products. And I really wish I had taken before and after photos, because you don't really see the impact of the changes in your skin. I had used good skincare, great skincare, and I had done a lot of, exfoliating of the skin and toning and stuff like that. He's right. Getting skin ready really is cleanse, exfoliate, and tone, and it works synergistically together. Mm-hmm. The improvements in the texture of my skin, the size of my pores. This is going to sound really funny, but, I even have up on my computer his clinical trial from getting skin ready and how much you can decrease dirt. Yeah, there was dirt in my pores on my nose that now that I'm using my complexion pads, I'm toning. Not only has it decreased the dirt, but it's also tightened my pores.
Yeah. Yeah. And so even if we went to getting skin ready, which is, again, always simply going back to the very beginning, like his...
The basics.
Philosophy with getting skin ready is 3 steps. So cleansing, and you can correct me if you think I kind of dummy it down and simplify it every time, because we're talking about services and, and procedures in the office. And then we're always talking about skincare. But by the time I get to the skincare part, somebody's always kind of taking over for me, because they know even a lot more about all the different products and what they need. Marissa, for instance, is amazing with that. An active cleanser. He doesn't feel like you should put anything on your skin that doesn't do something. And so an active cleanser that's getting it off, there's a couple different types that Christina can talk about. And then an exfoliator and an oil control. And so again, getting those dead skin cells off to let your skin cells function the way they should. What we typically do is we feel dry, we put moisturizers on, then we pack in dead skin cells, and then we prevent our skin cells from actually functioning. We take over the function for them. And so you have to get all those dead skin cells off with exfoliation. You need to control the oil because that packs in dead skin cells as well, and let those skin cells function. Again, those are just the first 3 steps, and then we can get to all the other, corrective steps that we can do. So there's a couple different cleansers, and that's where I would love for you to, get into more depth about even the cleansers.
Absolutely. So with ZO, we have 3 different cleansers. We have a gentle cleanser. That cleanser pretty much anybody can use. It's for combination to oily skin for anybody. The one thing that has impressed me personally most with the gentle cleanser, and I get a lot of this feedback from others too, is it really gets your eye makeup off really well.
Yes, it does.
The mascara, yeah. I was actually really impressed because before joining ZO, I actually used to use a makeup remover. And even using a makeup remover, I'd still wake up with black under my eyes.
Okay.
And that is one thing that's impressed me a lot with the Gentle Cleanser.
That's the one with the blue beads in it, right?
No, that's Exfoliating Cleanser.
Okay.
That's
where I love the
blue.
Foam Cleanse. So if I sound, a little, I am in love with the Foam Cleanse.
Foam Cleanse is Gentle Cleanser. It's the Foam Cleanse. It's still the back bar name, but it is. They had changed names to Gentle Cleanser.
Okay. I still refer to it as Foam Cleanse.
A lot of people do.
Which is why they take over after. He has changed names a few times to simplify things, actually. It's made it easier in the long run, but if you really like something, you kind of cling to it, right? And so I'm still on Foam Cleanse. So that is the Gentle Cleanse. Love it. It smells great. It gets everything off. Yeah. No, I would agree.
And then we have the Exfoliating Cleanser, which has some exfoliating beads in it. It also has a 2% salicylic acid, but it's not like anybody couldn't use it. The one great thing that Dr. Obagi has done with this line is we have actives, right? And we have things that are going to help to treat, but then it also has different items in to help hydrate the skin too. So it kind of balances itself out. The last cleanser we have is the Hydrating Cleanser, which I actually really like the Hydrating Cleanser too. And to be honest with you, I use kind of a little bit of all. It's not like our cleanser is going to make that much of a difference. That really it's more the preference of your customer and kind of what they prefer. Some people really like that gel, the exfoliating cleanser with the beads in it. And then some people really like you said, with the Gentle Cleanser. And then you're always going to have some that really like that creamy cleanser, which is the Hydrating Cleanser.
And so I think that hydrating is more for the dry skin and then exfoliator for the oil. And maybe that's another reason why I kind of go to the, I already like the Foam Cleanse or Gentle Cleanser, but you can use it for all skin types too then. So, all right. I love the Foam Cleanse.
So to add to that, I've even had a few patient friends try the Hydrating Cleanser who were very oily, or at least they thought they were. I said, just try it for 3 weeks and let me know what you think. So don't use a moisturizer. Just do the Gentle Cleanser and the the Hydrating Cleanser for actually dry skin and complexion pads. They loved it. They actually did see a difference with their skin. That was kind of something very different, but they were actually oily, or thought they were.
And once again,
anyone can use it.
Well, and once again, I always kind of thought I had dry skin. So when I started, of course, I was running away from the complexion pads, but that was the one thing that I was missing. And it is very neat how even the complexion pads have a little bit of salicylic acid in them, but they also have hydrators and botanicals in them that hydrate the skin. And it's unbelievable how you think you can have dry skin and you start using the 3-step cleanse, exfoliate, and tone, and how your skin just looks, getting skin ready. It just looks great. It also preps the skin, obviously, for all the treat and correct, which would be our step 2, products to basically work better and to penetrate the skin better.
So your product goes further.
And
it's more active. But, and then again, I think that it's so important because I hear all the time I have oily skin, I have dry skin, and just going straight to that. If you just switch to those first 3 steps and let your skin function, then you may not have those. So I agree. And a lot of people do not then after. And they've been living with that story of oily or dry skin forever. And then the exfoliator, which is my favorite. How many times a week would you start?
2-3 times a week with the exfoliating polish or the dual action scrub. The dual action is more for oily skin. It's what is the ingredient that heats with the dual action scrub?
Oh gosh, I'm not sure.
It has a little heat, but the dual action scrub is probably my favorite as well. I like the exfoliating polish, which is usually in most of the kits because it's for anyone. But 2 to 3 times a week is more appropriate. Every day using a scrub might be a little much when you're using active ingredients and stronger exfoliants.
So I love, again, the dual action scrub. That's my favorite. And the other one is the exfoliating polish. So the dual action is just a little more gritty, you're going to get more off. So the oily skin, it makes, again, I love it. And I love the oil control pads, which again goes more towards that. I have oily skin. I don't really, I just really love the way that those two work together. But the other ones that are more gentle is the complexion pads and then the dual action scrub. Or not dual action, but the polish, the exfoliating polish. So,
and I actually, you can start out using the exfoliating polish 2 to 3 times a week. I use it every day now.
Working your way up.
Yeah, you can work your way up to use it every day because, Dr. Obagi does not believe that you can over exfoliate your skin. And when you look at the exfoliating polish, it's an ultra fine magnesium crystals and they're completely round. So they're never going to like tear or do anything bad to the skin.
They're awesome. Love to get the dead skin cells off. So then after, if you were to pick the next product that everyone needs to be on.
Daily Power Defense.
Daily Power Defense. All right. Which is antioxidants for the skin.
And a whisper of retinol.
Yeah, and a lot of people don't realize, but a whisper, like we can't even tell you how much it is. And literally it is just to stimulate the skin cells. Because as we age, our skin cells get sticky. Dr. Durst was talking about that along with, moisturizer kind of packs them down. So it literally is just enough just to get the skin cells to turn over. But it is your antioxidant serum, DNA repairer. So it's going to help protect against free radicals. But it's also your hydrator, you guys. It's got a lot in it that hydrates. You're just getting, instead of just a moisturizer, you're getting a lot of other benefits with Daily Power. And we do recommend that for everybody.
Well, and it comes down to, again, he doesn't believe you should put anything on your skin that doesn't do something. So just picking a moisturizer that does nothing, but if you have antioxidants, a little retinol, a little hydration, then it's doing something. Yeah. So even those patients that feel like they have dry skin now have a moisturizer, but it's active. And so that's the way I look at that in the morning and in the evening too, or would you go to another product in the evening?
Each protocol has something a little different, and there's not a wrong way of using it, but there may be a better way of using it.
Well, what if you were to start with like a beginning person maybe listening to this that wanted to start? Obviously, we have Getting Skin Ready, and we've talked already, and we can kind of summarize it quickly in the end, or even in show notes, actually, oily and dry skin, and we can talk about that. But if the morning was Daily Power Defense, would you use it again at night, or would you put something else on to start, like your basic entry-level person that you really don't know, and they don't know either because they think they're dry or they're oily, but maybe they're not? What would you go with next?
Growth Factor for night and Daily Power Defense during the day. What do
Absolutely.
You, Christina?
Absolutely. Our growth factor is a plant-derived enzymatic growth factor. And for some people who feel like they need moisture, it is moisturizing, but it literally is Botox in a bottle. It goes hand in hand with their injections, their toxins. It's going to help. It has a complex in it that's going to help to relax expression lines and help with fine lines and wrinkles, but increase hyaluronic acid and collagen production within the skin as well.
I love Growth Factor. So that is like, and it smells great, and it would be my next one. So that's usually where I go with that. And if I'm starting somebody new, I typically do with an anti-aging kit, to get them started, try everything so that then we can figure out, are they dry? Are they a little more oily? Did they like what they had? And that has Daily Power Defense and a full size Growth Factor, which is awesome. And but they're smaller, so that you can try them all, but the Growth Factor is a full size. And that's exactly what we talked about for more gentle, dry skin or oily skin. Right. So you can go either way.
In the anti-aging kit, there is exfoliating cleanser, exfoliating scrub, complexion pads, Daily Power Defense, and Growth Factor serum.
And that kit,
5. Yeah.
Oh yeah, and that kit really is a huge bang for what you get cost wise. It's about a $303 value that you get for $213. But you're right, Dr. Durst. It's awesome for them to walk out with those products. Not only can they try them, and then we can tweak their Getting Skin Ready portion, right? Because that's the thing with his line, is that it's customizable for anybody. So we can tweak it, but they also a lot of times will run out at different times for you. So it's great for the consumer who comes in and you're only having to buy a cleanser or exfoliating polish at a time instead of buying everything.
Christina, let me ask you, on Dr. Obagi's concept and ideas for the neck and chest. That's something a lot of people don't understand is whatever you do to your face, you should do to your neck, and probably go ahead and bring it down to your chest décolleté area. What's Dr. Obagi's idea?
No, absolutely.
Especially growth factor.
Oh, yeah, absolutely. Anything you do to your face, you should do your neck. The one that you don't want to do, that you want to be cautious with, would be retinol. And I think we had talked about talking about those anyway, but that's the one that you would want to be a little cautioned with, because your skin on your face can tolerate more than your neck. Your neck's going to be more sensitive. And, you know, me, I told you, actually, I came in and saw you and you did a peel on me to help with my getting acclimated to retinol.
Right.
But that, even when I was going through that, would migrate down to my neck a little bit. And that can be, it can itch and be red.
Well, discomfort temporarily.
Absolutely.
And that discomfort is your skin acclimating, but it might be a little uncomfortable until you acclimate.
Yes,
So, yeah.
but the end effect is absolutely beautiful and amazing. And we can go into retinols really quick if you want to, but our wrinkle and
I don't even think you need to make it quick, relatively quick, considering all the products we have, to cover, and we can always do, more specifics after. But I think retinol is so important, and that's why I say that. It's probably the next step for everyone, because I think everyone should be on it. And
It's
again,
vitamin C
if
and
you guys talk a
sunscreen.
little bit more about that, that'd be perfect.
when you look at Dr. Obagi's line, the ZO line, it really has, we have so many products that have retinol in them, and it's because, vitamin A is the superhero of skincare. And we put a lot of those into our products to help with with the turnover, just like in the Daily Power, where it has a whisper, just to help those skin cells turn over. But the amazing results I've seen from implementing wrinkle and texture repair into my own skincare routine have been amazing. I've been a person that I've never been compliant to using retinol. I've tried to use it in the past. It's just never worked because of the irritation. So we have a couple different products that really can hold the hands of people as they go through it, including Hydrating Cream or Firming Serum actually is a great hydrator repair that helps through that. Or even an AHA enzymatic peel can play a role in that as well.
The Retinal Skin Brightener, because of the different percentages of retinol. We got a 2.5%, 0.5, and a 1%. So if someone was a little bit more sensitive, they might want to start off a little lower, or it was for their body. We have a lower percentage for them.
Absolutely. You really could use the Retinal Skin Brightener on your neck and your chest and start out with the 0.25 would be a great place to start, because he doesn't want brightening on that, right?
Absolutely.
And it's a way and it really is a way to start out kind of lower on your neck and your chest. But like I said, the wrinkle and texture repair is so amazing. It has some of our other complexes in it, like Z-Core, and our Z-Core complex is also what's in our firming serum, and that really works on the dermal epidermal junction, which is the key of your skin. And to explain it so that people can understand it a little bit better, it's kind of like a peanut butter sandwich where you have the two pieces of bread, and in the middle you've got your peanut butter, and your peanut butter is your dermal epidermal junction, which has your fibroblasts, I can't even talk, in it. And basically that's like the core of your skin. So our firming serum and wrinkle and texture both work within the peanut butter, which is the actual part of your skin that holds everything together. And when that's weak, that's when you see wrinkles. It's when you see texture issues. So, but it works great for patients who have acne. It's going to work great for acne scars. It's going to work great for wrinkles. It's going to work great just in the texture of the skin. It's an amazing product.
And then obviously protect after that.
Absolutely. And we would, oh my gosh, nobody can leave without sunscreen. You have to have sunscreen. 90% of our wrinkles come from the sun. And obviously if you're using a retinol, you need to be a little bit more cautious too about protecting your skin. I mean, I don't go out of the house to even walk the puppy without my visor on, my sun visor that I wear on the beach. So I always take caution with that.
Oh, yeah. No, you need sunscreen. Again, people will look to get, certain services, or a filler or Botox or, under eye, and we'll talk about those, products. But not take the time to learn more about skincare and skincare products, which are so important. And look at their skin. Look at both of you. Like it's just smooth and shiny. And so that's exactly how you want your skin. And, if you're committed to having good skin and looking younger and, brighter and tighter, then skincare is an absolute part of that, for sure. Yes. Not just the services. And so frequently that's what we'll do when we educate when people come in, because, if they were going to get a service done, they need to know that they need to have sunscreen and they need good skincare, medical grade skincare products. And it's a rabbit hole, right? Mm-hmm. They go over to Sephora, Ulta, online. And again, even if you're talking about like Rodan & Fields, for instance, it's a very common misperception is that that's a medical grade skincare line. And, just knowing that it isn't, and, and educating them about good skincare lines and products. And definitely has to happen. If you're going to spend all that money on all those other procedures, you need this on a regular basis if you want your skin to look like Marissa and Christina here, which are beautiful, shiny.
You have to invest in
clear.
The skincare. Or
Absolutely. Yeah.
You're not investing in the treatments.
Mm-hmm.
And I agree. And that's actually another testimonial I can share with you is the embarrassment. I never even took a picture of the basket of products that I pulled out of my bathroom.
You gave them away. You told me that
I did.
You gave them away too.
Donated them.
Yeah, you donated them, right?
I donated them. Mm-hmm. I had so many. But people will say that I can't even tell you how many products I bought from Sephora and from Ulta, and all of them were moisturizers of some sort.
Yeah.
I had so many. My niece actually has made fun of me for years. She calls it my creams, all my creams that I use.
Mm-hmm.
So I've been aging myself a little bit with all my moisturizers I've been using.
Yeah. Well, you've reversed it now.
Absolutely.
So it's good. Yeah. And that's what can happen. Like, again, just committed to it. You can make a huge difference in your skincare and your and the texture of your skin. So that actually brings me to the point that there's a lot of women with a whole kit of creams from Sephora and Ulta and, Walgreens and CVS and online stores, and again, so it's worth it, and it simplifies it. It seems difficult, but it's so simple after, because again, you don't have to go to multiple places to get everything you need, and there are a few simple steps that will get you the skin you want. And so if we were to talk about, because one of the common areas with both men and women, and we do a lot of under eye treatments, and it's a common complaint with aging. And so it's the thinnest skin in the body, and we start everyone on eye care. So talk a little bit about the eye products.
I'm so glad you brought that up. So my actual favorite eye product is Growth Factor Eye Serum. Mm-hmm. It's our newest eye product. Obviously, it's plant and enzymatic derived, just like our Growth Factor, but it has 4 more ingredients in it for under eye. My own testimonial to this product was when I first started with the company, I really was using Growth Factor under my eye. The difference that I see with the Growth Factor Eye Serum is amazing. I haven't worn concealer under my eyes in at least 2 months. And I've worn concealer for years. So cool. Oh gosh. Yeah, it's amazing. So it does. Basically, what is so great about it is that it honestly works just like our Growth Factor. So it's going to help to fade out those lines and wrinkles around the eyes, but help to relax them too, because it has that complex in it. Mm-hmm. But it also has a nice cooling massaging applicator on it. It's great to stick it in the fridge and use it, because then it's really cool, the metal applicator, but it's going to help with
hollowness. I never thought about that.
It's very nice.
I haven't
very
put
nice
it in the
idea.
refrigerator. Yeah, no.
Oh, stick it in the refrigerator. That's the way I do mine, and I just go out and stick it on. But I love it because it's
when
cool.
we wake up in the morning and we have this,
Tired
more
eyes.
prominent bags under our eyes, we should pull out the cool Growth Factor and put it under there. It's a good idea. It's an awesome idea.
But that helps with, like I said, the expression lines, but it's also going to help thicken the skin. You're talking about how that skin is so thin. That product's going to help thicken the skin under the eyes. And it's going to help with hollowness and puffiness.
Mm-hmm.
So
the importance of eye treatments, like eye skincare, because again, it bothers almost everyone, both men and women, as they age for various reasons. It can be prominence, it can be hollows, it can be discoloration. It could be eye bags. We have lots of fantastic treatments for them, but there's no one that doesn't get placed on an eye cream, because that's number one. We can send them home before we even schedule the services once we do a consultation, because they're already starting to thicken the skin, but that has to happen. We do crow's feet and Botox, and we don't do eye cream. Yeah, so we have long conversations about that, and it's so important, both men and women. So, and again, some of these we'll put in the link, like some of the, this is one of those podcasts where we can put some things that we're talking about in the link and maybe simplify again at the end.
I love the eye brightening cream as well. The intensive eye cream is amazing. The Growth Factor Eye Serum is a newer one, and we do like it very much. We just have more experience probably with the eye brightening cream and the intensive eye cream.
And obviously your eye brightening cream really is going to be for people with really dark circles. And I'm hoping to get a really great before and after on that one. I'm working on one. But that really is more targeted for that. The intense eye cream really is for skin texture and elasticity for under the eyes. It's going to have it has a creamier, thicker consistency for people who like that. Both the eye brightening cream and the intense eye cream both have some retinol in them, where the growth factor does not. So that's kind of some of your differences. And I actually just got a piece on the differences of those that I'll give you so that we can put those where you're talking about listing them. So people can see those.
Perfect.
Okay.
Yes. Thank you.
Awesome. Let's talk a little bit about the sunscreens, actually, because I think those are ones that even I need a little, reminder of the ones that I'm not using. So just an overview of which ones you guys like. Oh, yes. So the powder is new, right?
Ladies, the new powder. The powder, by the way, I made a phone call and got a couple extras of those if we need to try them, if somebody's wanting to try it. That is my new favorite product. I really was like, nope, not using it. It's a powder. I haven't used powders in at least 5 years because they always sit inside of your wrinkles. And I feel like once I stick a powder on, I actually look older than I did before. So I don't use them. And I can't remember off the top of my head, and I don't want to sit here and flip through my book because I know I wrote it down, but it has something in it that makes it not settle in the wrinkles. But our powder, once I watched a video on it and learned how to use it, I actually love it. Sometimes it's, just like you said, sometimes it's education, and it's so silly. We do have 3 colors. Most people use the medium.
Love it in the office. They got it for once you came in and talked about it. There's at least 3 that would have breakouts, that are breakout prone. And they would have breakouts with sunscreens. And so they love the powder.
Yeah, and it
a little feedback.
Yes. Oh, yeah. And probably why they like it, you guys, and I learned this in the video that I watched, is our powder connects to the oil in the skin, not the water. That's another reason it doesn't settle into your wrinkles and make you look worse than you did. Make you look older.
That explains a lot.
I know.
Yeah, it's my new favorite. But I use it in combination with our Smart Tone. So we have 2 different sunscreens. One's a physical and one's a chemical. The Smart Tone is a chemical, but I love because it has more of a dewy look to it. And you can put it in your fingers, and as you rub your fingers together, it gets darker, the color beads, and it'll get darker, so you can make it match basically your skin, and you can also make it a little buildable coverage. And I do it that way. And then we have a physical sunscreen, which is one that some people absolutely love. And it's a sunscreen primer. It has a primer in it. And if you like that matte look, you will absolutely love the primer, the sunscreen primer.
So the tinted are Smart Tone.
Yep.
And then sunscreen with primer. And the primer is more of a matte. And the Smart Tone is more...
kind of a dewy look.
Yeah, all right.
Yeah,
kind
of with color beads.
With color beads, yeah.
And the primer is an SPF 30.
It is.
And the powder is SPF 50.
I need to look up the powder.
Refresh me on that. And then the Smart Tone is SPF 50.
It is SPF 50, yeah. Now the brush, I need to look that up because I am not sure what that is.
What about body, physical, non-tinted? What are we, and most of them are actually a combo, I think, of physical and chemical on the body.
So we have 2 bodies, and one is the Daily Sheer, and the other is Broad Spectrum. And I'm going to be honest with you, Dr. Durst, I can't remember which one's which, but I can look it up for you.
So Christina's not been with ZO for that long, just so you know, and she's done an amazing job of educating herself on all of the products in a very short period of time. So we don't expect you to remember all those details. Listen, Marissa and I learned about this line and have been like crazed in love with it since 2014. You said 12?
Before that, yeah.
12,
but
right?
that's when we actually went to the conference that Dr. Obagi was actually speaking
Yeah,
at.
no, that's right. So it was right around 2011 or 12, I think. You did my first 3-step ZO peel right around that time. Mm-hmm. We were just looking at pictures of that the other day. It was so long ago. But anyhow, and we cannot remember the details of those little details. That's why we're trying to again, go over it, because I've heard him talk 3 times now. And again, amazed at the guy.
He'll change your mind about anything.
Yeah.
He's going to care.
I mean,
or confirm it.
So the way I always say this is what I tell people and patients when they're in the office is that he's a medical doctor. Medical doctors versus surgeons tend to be a little more conservative, in their approaches. They're kind of, in medicine, surgeons are hands-on, a little more aggressive, a little, have a, different approach to things. In medical, they tend to sit around and kind of talk and chat and come up with a game plan, and that's more medicine. It's more cerebral, less hands-on aggressiveness. And that's just a gross oversimplification, but he's a medical doctor. And again, when you watch him talk and he shows slides of what he does, he will actually, take people to the OR. Again, people that have been referred to plastic surgeons with bad burns that they've had options exhausted. They have no other options, and they go to him as a last resort, and he gives them new skin. He basically takes them to the OR and will show videos and before and afters of how he'll peel them down to a deep dermal, and then you think they're done, and they already look like they're not going to recover. And so I'm sitting there watching it thinking, I'm never going to do that peel. And so because it looks, it's just very aggressive. And again, it's supposed to be. And that's not the 3-step that we're talking about. That's like a blue, what was it called? It's a blue peel or something. It's like
Obagi blue peel was the original. The
I think that's
ZO
what it is.
version
So
something depth. Hold on.
Controlled
depth. And then he actually, so you think he's done then, and it already looks bad. And then he's like, and then I laser them down to it, and so then he lasers them on top of it. And I'm like,
they look a blue vampire.
Holy crap, he is not going to. And then you see the after that. And again, they're asleep. There's no way they couldn't be asleep for this. But literally new skin. He basically takes them down to a level that no one's going to take them down to, and they grow new skin. Like the skin level that your skin cells start with. So think about all the surgeries that people do in the grafting after burns, when in fact none of that's going to make you grow new skin. That looks in the before and afters like literally
they look like their oldest grandchild
amazing.
Afterwards.
Yeah. No, and so again, so if you think about a CO2 laser peel, that's, nothing compared to what he's doing. And a CO2 laser peel, people are down for 3 or 4 months in repair, and their skin looks amazing. People don't always want the downtime, but if you had bad burns somewhere, and you needed to repair them. So anyhow, he got my attention and my respect. And so I've seen him talk now 2 times since then, so 3 times total. And again, I just think he's amazing, and his skincare products are, and his knowledge, and he goes through his reasonings behind it. So he's definitely, our favorite, at least Marissa and myself. And now that you're on board and everybody else is in the office too, just love their product. They're younger, and they haven't yet seen him talk. So they're watching more of the videos, but he's amazing. So anyhow, that's kind of what we're talking about. And so Christina has to learn all that. Like, this guy has a lot of knowledge. And if you look at a guy that's medical, not usually in the operating room doing things, and now is doing things that even the surgeons won't touch, that's pretty amazing stuff. So.
Well, and that goes too. He's renowned. I think if you just type in the computer skincare, Dr. Obagi is going to come up. then Obagi is going to come up.
Mm-hmm.
And he literally has,
Yeah.
we have clinical trials on everything. And that's what I have, the clinical trial of getting Skin Ready up on the computer. And literally I can tell you from that clinical trial how much dirt was removed. So, I mean, everything he has a lot of science.
Yeah.
I think the one thing that made me like, oh my goodness, was when he does peels and watching him do peels and he does the eyelids.
Mm-hmm.
Yeah. He even does eyelids.
Yeah.
So, yeah.
No, he's a badass. For sure.
He is.
There's no other way around that.
He is.
That's true.
Yeah,
That's true.
And then like the history, again, people, Obagi, a lot of people know of the Obagi line, and he defoliated with Obagi because, again, once it went public, just an oversimplification, but once it went public, they were doing things that he did not agree with, and he no longer had control over it. This is a private line with his own lab, and so can develop products and have control over them. And so again, medical grade, the best medical grade skincare products you're going to get. Mm-hmm. And we have another line in the office that again has scientific and research base, which is the only way to go. But like ZO is like definitely Marissa and I have been talking about this.
He never stops with his research ever.
Yeah, yeah,
and he's never afraid to try new ingredients and prove himself right or wrong, and he'll tell you happily.
And so one of the products that we can talk about, because again, you can go on forever, and I think another podcast would be good to cover certain other ones. I think getting a basis, and we'll summarize it. But the one thing that is unique to his line that we haven't really talked about is I always want to say hydroxychloroquine, since it's a hot topic, right? Hydroquinone, so that we can just talk about that for a few minutes because, again, that's one of the main reasons, that's a stand apart too for his ZO line, even different from Obagi because of the time limitation on use. So, and you guys would be able to talk about that more than I would, but pigment being an issue with a lot of people. And even if we're doing melasma, which is a hard thing to treat, and hyperpigmentation, period, is a hard thing to treat. And so talking about the different ways you can treat that, short of any other type of service, just with the skincare. You guys want to talk about that for a moment?
Yes.
Sure.
So hydroquinone, the products that are in the ZO line are the pigment control. There's the blending, the brightening, and the brightening plus 20% vitamin C.
Dr. Durst, you were talking about one of the biggest things that he noticed with hydroquinone and with retinic acid is that patients were becoming resistant to therapy. So that was why he ended up doing his own line. We actually have a maintenance line. So we recommend you use hydroquinone for 5 months, and then you go off treatment for about 3 months. The nice thing about it is we have a maintenance protocol that you can use that patients, everything that they worked for in those 5 months, it's going to stay while they're doing their maintenance before they go back on hydroquinone therapy. Because just like you guys know, there are some people out there, just like my trainer, who is constantly either on hydroquinone or the maintenance of it to keep her skin and her pigmentation at bay in a way. He does things a little bit different. We know that, right? Like he's a little bit different. His philosophies are a little bit different. We're all about sebum control because even people with pigmentation, that's basically just inflammation of the skin and mostly from sebum. So obviously that's a lot of getting skin ready, and we try to keep that sebum at bay to help with that, and then obviously put correct and prevent products on top to make it look even better. But with the hydroquinone, we really do recommend it when you bleach your skin that you blend it. The reason being for that is it's kind of like these new flat paints that we are all using on our walls these days. If you get something on it and you go to wash it off, it always leaves a spot, and you have to wash the whole spot out, the whole part of the wall. You have to kind of blend it out. So that's kind of our thought process behind the bleaching and the blending, is the blending really kind of blends all that out and gets the pigment to go across the skin evenly. It also helps with that. It has 4 different ingredients in it that help with that.
I think that's a good starter, because again, it's a lot to take in, but I think that, just knowing that you have to come off of it, but you have to be on a maintenance, and again, blending it, those are good starting points for that because, and again, pigmentation's a hard thing to treat. And so it takes time, and patience is key. And everyone needs to know that. And then adding heat and devices that have heat can make that worse. And
especially with darker Fitzpatrick's.
Yeah, with darker skin types. So basically, starting with the skincare, prepping it, even if you were doing something else with it, but staying away from heat unless if you've seen somebody very experienced with hyperpigmentation, melasma, or darker skin types. And so,
because there's so many different protocols specific to the individual that there's just lots of questions involved that we would need to go over with that person.
And Marissa is excellent with darker skin types, for sure. The most experience that I've seen of anyone with darker skin types. We talked about that at our conference this weekend multiple times, because we're working on 4D before and afters for the company because of our patient population, with Marissa's patient population specifically. So it's a great thing. So in summary, even for this, because then we'll talk more, like we'll go into it at another time where maybe we pick an area or something specific. We did do a retinol talk before, kind of went into the different ones, but I think that would be another good one to have you back for, where we go into retinol, retinoic acid, tretinoin, and all the different types of vitamin A products and derivatives thereof. So, but in summary, so like basically and pipe in whenever you guys feel like you need to correct me. But so his is a getting skin ready, no matter what, 3 steps: an active cleanser, an exfoliator, and oil control. And you can do that in something for dry skin or something for oily skin. And that's how we should put it in the show notes, so that, that getting skin ready is both ways. And we're not going to put it as a getting skin ready. Those products, we're going to do it as an anti-aging kit. Essentially, there's 2 of them. There's a more aggressive and there's a straight up one that actually has both skin types too, right? Does the anti-aging have, can you do the like oily? You can do 2 different.
Actually, I think they just have it one with the complexion pads, if that's what you're saying.
Okay, all right.
Exfoliating cleanser, exfoliating polish, and complexion pads with the daily power defense and the growth factor serum. Now, there's a daily skincare program.
I think she's thinking of the aggressive one.
Okay, so I might be talking about aggressive.
You are.
So in Diff IM, the only thing that changes with that is that it has a radical night repair in it.
And renewal cream.
But it still has growth factor, doesn't it?
No, it doesn't.
Oh, all right, that's the difference. So
yes.
So I think, so we'll put in the show notes again, getting skin ready, and that's a good starter one. And that would be the anti-aging kit then, because it has a cleanser, exfoliator, oil control. They're smaller. You can try them out. If you feel like you still have some oily skin, then you go to the more aggressive cleansers and exfoliators and oil control pads, because they're smaller, more trial size, so that you can try them and then you figure out whether you like them, instead of committing to a full size until you know. And then that beginning one has daily power defense and a growth factor. And that's why I was looking at pricing, because it seems like it was a little, but it was $213 and then it's $263. The links in the notes will be if you go to the website and buy it. Sometimes it's a little different if it's not off the website, so that's a definite thing to use from the link in the show notes, because it'll be on there. And then, the sunscreens, the Smart Tone, the different ones we talked about. So Smart Tone,
Sunscreen Primer, and then the sunscreen
primer,
brush.
and then the brush for sure.
One thing we didn't mention with the sunscreens is the HEV factor.
I'm so glad you brought that up, because I've been wanting to bring that back up, but because that's one thing about our sunscreens too, is that we have triple protection. So we have the UVA, UVB, the IRA, but we also have HEV, which is a huge one for all of us these days. It's our blue light. So it's our computers, it's our iPhones, it's our lights, our overhead lights.
I'm glad you brought that up too.
And
all of them have it.
They all have it.
And that's one thing you're not going to see with a lot of the sunscreens. And again, a professional line of sunscreens is the way to go. Definitely don't want to just pick it up. So I forgot about that too. I'm glad you brought that up.
Yeah.
Because that's not a well-known fact. So we can put that in. And so Smart Tone, sunscreen with primer, the brush, and then there's a physical.
And
there's the body one.
And I actually had brought those up for you too. So the physical one for the body is broad spectrum, and that's a 50 SPF.
Okay.
And then the daily sheer is the chemical, and that's also a 50. So we have both of those for body or for face, right? For guys, because guys don't always want the tinted. Although, what's a little bit of tint going to do for them? But
they're not putting tint on.
No, they're not going to. Mm-mm. So those are...
They lay down on their pillow at night, and they're not cleansing as much as they should either. And their pillow tints? No. I don't think so I think you're right. They're going to want the non-tinted. And then retinols, too. So we'll put those in there, too, because wrinkle and texture repair is a good one. And again, there's other ones that we can put in if you're used to them, just so you have those links. So if you've heard about the products, but that anti-aging kit is an awesome one to start with. Has everything in you need. And the growth factor alone is a $149 price if you buy it alone. And they couldn't get it in a smaller, so you get the full size. So it's well worth the kit for sure. Good starting point, anti-aging kit. And again, the anti-aging, more aggressive, is good for older ladies, but you really got to get prepared with the retinol.
Because it can be used as an at-home peel.
Yes.
But it is a major texture change. Mm-hmm. It's a beautiful finish.
So we'll talk about that all the way around. I think all retinol talk next time, and all the derivatives thereof, because you're right, wrinkle and texture repair, or not wrinkle and texture, but radical night repair is a great peel at home, but you have to prepare.
Yep,
absolutely.
The patient, because most people think they can't use retinols because they're sensitive to them, right? But that's a normal reaction, and people don't understand that. And so they're really going to get that with wrinkle and texture, or keep saying that, with radical night repair.
Absolutely.
It's a little more aggressive. And so, just getting their skin a little bit ready for that before they go to it is necessary.
As we call it, precondition. Let's get them to precondition their skin.
Precondition, pre-treat, pre-game it.
Pre-game.
Right?
Pre-game.
Everyone understands the pre-gaming.
Especially
pre-game for a radical night. Got a pre-game. All right. So anyhow, anything else that we missed?
One last. Our vitamin C is not a water-based. Ours has no water in it. It comes in a completely sealed container. The nice thing about that is every time you open it, it doesn't degrade. So you're not going to get a funny color with it. It's not going to break down. It's vitamin C.
Not going to be oxidized.
Percentage.
Yeah.
Absolutely. Ours is a thicker because it doesn't contain water. And it actually is silky smooth and kind of reminds me a little bit of a primer. Feel to it.
I love the vitamin C.
I
It's
do
very,
too.
so if you have oily skin at all, I feel like that's an awesome one, because especially a lot of the other products is more of an oil, serum, something along those lines. But it is so, and it actually tingles when you put it on. So it feels good. Like you can tell it's working as soon as you put it on. So I really do love that product. And it lasts for a long time too, because you don't
really
need too much of it. And so that's another good one that can lighten your skin without a retinol. As well. And so you're talking about lightening. What are the other benefits of vitamin C?
Brighten, lighten, brighten.
Lighten, brighten, the antioxidant. Just think about it from an IV standpoint, or like basically if you're doing it in IV or you're doing it in a supplement form, it's an antioxidant. It's helping your cells function better, so it's helping the skin cells and lightening, brightening, protecting. Yeah, it's a beautiful product too. And that's the only product, right? The only vitamin C product.
No. There's Bright Alive, and then there's Pigment Control Brightening with 20% vitamin C. That's a similar formula as the vitamin C specific.
And then we have Retinol Skin Brightener too. We're going to go into all of the brightening. Let's do a separate one on retinols, and then we'll do a separate one on brightening too, because it's too much to kind of go over.
Yeah, no, I think that's good. And so the vitamin C is called specifically, is it an activator now? Did he change the name for that one too?
It's called vitamin C, but it activates with the water in your skin. So you kind of, and that's probably where you're getting that thought. You kind of want to rub it a little bit extra. Yep, because it activates with the water in your skin.
Earlier that,
vitamin C
Bright
activator.
Alive. Well, no, it might have been an old name. You don't have to look.
It used to be called Essential Vitamin C.
And then
Brightener,
and then basically you're talking about the Bright Alive, which is another great pigment lifter for young patients that like freckles. I think of freckled people that like may want to get pregnant, so like younger childbearing ages and you don't want to use maybe a retinol, you can put them on the Bright Alive.
Bright Alive with the vitamin C, and you're right. It's called 10% vitamin C self-activating. Is what you're thinking.
Yes.
Okay, all right.
Self-activating, and it does. It self-activates with the water in your skin.
Yeah, it's an awesome product. So
it is an awesome
for lightening
product.
the skin, lightening, brightening, and just protecting those skin cells. So. Awesome. Well, all right. So then we'll put everything in the show notes for links, and kind of a little description about what we were talking about underneath it. And thank you so much for coming and helping to clarify it for me again, because I have my favorites that I go to, and then I put the girls on, talking about all the products after. So sometimes I don't get to hear about the ones that I don't use all the time or recommend all the time. So thank you for coming and clarifying.
You're very welcome.
Christina.
And we
Marissa
need to do
and Christina are very good at this tag teaming together for ZO products because, again, Marissa loves ZO and knows it very well.
And we do. I
ZO.
just thought about this too. We need to do a separate one on acne because look at the great success we've had with acne in your office.
Yeah. And we'll
some of your employees.
And we'll get the afters by then too. So we'll do a retinol, vitamin A derivative, we'll do a skin brightening, and then we'll do
acne/rosacea.
Rosacea,
There you go.
Absolutely.
Sounds great.
All right. Yeah, because wrinkle and texture repair is like a huge favorite for all of those girls that were acne prone. So thank you for being with us, and then we'll schedule some other ones and talk about these amazing products more. So again, we're here to revitalize your look, your health, and your sex life. So follow along, tag, or actually just comment if there's anything that you want to talk about, any ZO products you've used before and that you might want to share your experiences. Subscribe, hit the bell, share it with friends. Let us know if there's anything else you want to hear about, because we're here to talk about all things wellness and aesthetics. Thank you.